in all its guises to support them to deliver it.
So John Whittingdale.
Thank you, Mr. Henderson. And can I start by thanking my right honourable friend, the member for Witham, for obtaining this debate. As she said, we representing the County of Essex do work together very closely on these matters, and I absolutely endorse everything that she said, and indeed my right friend, the member for Colchester. I was actually elected originally for a constituency called South Colchester and Maldon. It included the areas of the Maldon district, which my right friend for Witham now represents, and indeed a number of wards within the Colchester constituency. And during all the time that I represented that area, we have been debating the problems of healthcare within the county, and in particular, the lack of funding. When I first came here, we were part of something called the North East Thames Regional Health Authority. And the funding which went in, and my right friend's absolutely right, the record of funding of the NHS overall has been very good, but we have consistently suffered from a skew, with more money going in originally to the areas of London, which were part of the North East Thames RHA, and subsequently, through the various allocation formulas, we have lost out. And actually, the funding per head has consistently been below, and that is reflected in some of the problems that we have, particularly because at the same time that we have been underfunded, we have seen steady population growth, and that is continuing. And my right friend referred to the 1,000+ houses being built in Heybridge, part of which fall within my constituency. I've got another development the other side from Heybridge in Maldon of another 1,500 houses. There is something like 3,000 houses going up in Maldon and Heybridge alone, with more houses across the district. They are putting steadily increasing pressure on the health service. The issue which my right friend referred to of St Peter's Hospital is one which is of huge importance to the residents of the town, of the Maldon district and the surrounding area. And I will be bringing this matter to the attention of the House on Thursday on an adjournment debate, and so we'll have a lot more to say about it. But it is fair to say, in summary, St Peter's Hospital is 150 years old. It has been steadily deteriorating, and in all the time I've been representing the area, we have been debating a replacement, and we've come very close a number of times, but each time it's never quite happened, and it's now reached the point where that hospital is no longer able to safely provide services in some of the areas because the original structure was not relevant, and although money has been spent on it, nevertheless it has deteriorated, and we have been debating whether or not to refurbish it or to relocate it for all these years, but nothing has happened until we've reached this point where it is now proposed to close it and remove services to other locations, particularly maternity and inpatient services, to areas which are far from my constituency, in particular some of the more remote areas. And that is something which I'm going to speak about in more detail on Thursday. But it is an indicator of the way in which I think that particularly my part of Essex has been underprovided for far too long. And that is also reflected in the issue which my friend talked about, which is access to primary care. We have 2 GP practices in Maldon. They both have patient lists well in excess of 12,000. I mean, and I know that across the country people struggle to get appointments, and we all hear about the difficulty people have in ringing at 8:05 and being told that they've all gone. But it is especially acute in Maldon. Both those practices are in facilities, in buildings which are simply not fit for purpose. And that is compounding the problem. And in each case, we are looking to try and reap a benefit from this housing development in terms of obtaining investment into infrastructure. And I do share my right friend's view that those currently trying to supply health services across the county are doing their best, and I absolutely join in congratulating and thanking the leadership of Essex County Council, who I met last week to discuss some of these problems, Kevin Bentley and his colleagues, and equally the representatives of the ICB. But we have reached a point where action has to be taken, and we are going to be looking for help to government. And as I say, I will be talking more about that on Thursday. But I know that every MP in this in the House of Commons will be claiming that their area needs more support, but I do think that actually ours is the consequence of decades of underfunding, and we have been shouting loud for too long without being heard, and we have reached a point where something has now to change. I do just want to touch also on the issue raised by my right friend, which is the Essex Mental Health Inquiry, now called the Lampard Inquiry. Again, originally my constituent, Melanie Leahy, now a constituent of my right friend for Witham, also my constituent, Lisa Morris, have been calling attention, ringing alarm bells about what has been going on in mental health care in Essex for a long time. When they first started doing so, they asked for an inquiry, and for a long time they were denied it, until eventually we recognised that clearly something was badly wrong. The number of deaths taking place under the care of the then Mental Health Trust was excessive and could not and needed examination. The government eventually agreed and did set up an inquiry, but it wasn't statutory, and they again came back and said it has to be statutory. We, at the time, said to them that we discussed with the then ministers, who said, no, there are advantages in it not being statutory, and therefore we shouldn't go down that road. Now the government has accepted, but it does have to be made a statutory inquiry. And at last, a proper examination can take place to identify exactly what has been going on. But there is still concerns being expressed by the campaigners who have lost family members, and I absolutely welcome the meeting which I had with my right friends, with the Right Honourable, my right friend, the member for Pendle, just a week ago to discuss how to proceed with the inquiry. There are real concerns over the timescale which is being examined and whether or not it can continue to examine deaths which are still taking place. Even very recently, there has been a death. Equally, there is the concern about the lawyers who have been working pro bono on this, Hodge, Jones and Allen, and they do need some kind of remuneration if they're to continue to do so. Other inquiries, the lawyers representing family members have received interim payments. I think the lawyers in this particular case also need some support, and I would ask my right friend to consider that. But most important of all, they have been promised meetings, and I know that my right friend is in the process of setting those meetings up, both with the Secretary of State in order that she can hear directly from some of the families that have been affected, and that he also is looking at this issue around the terms of reference and the process under which the inquiry proceeds. But this has been going on a very long time, and he will understand the frustration that exists. And so anything that he can say this afternoon about whether or not we can now press ahead, have those meetings with the families and those representing them, and to get a proper, full examination of what has happened in the Essex Partnership, University, NHS Trust, and its predecessor bodies, we would be extremely grateful to hear. Mr. Henderson, as I say, I will be returning some of these themes on Thursday, but once again I'd like to thank my right friend. We will continue to work together with my right friend for Colchester and across the county to ensure that our constituents receive the proper health care which they deserve.
Opposition spokesperson.